Welcome to your company nurse training. Through this entire video, if you remember only one thing, remember this. Accidents happen, call company nurse first. Even when you think you might not need care, even when you think the pain will go away, the sooner you call company nurse, the sooner you'll begin your path to recovery. Of course, if an injury is life-threatening, call 911. But thankfully, most injuries aren't, so you can call company nurse first. Company Nurse is a 24/7, 365 nurse triage contact center. The process is easy and not scary at all. Here's how it works. When an injury happens, look at the company nurse posters on the walls or the stickers on your phones. You'll find your unique contact center number and your unique search code. Either you or your supervisor will simply call the contact center number and be ready with the code. The first person you'll speak with is an Injury Care Coordinator, or ICC, who will ask for your name, the unique search code, your department or work location, and your supervisor's name and phone number. And by the way, if you or your supervisor don't speak English fluently, that's okay. We can bring in an interpreter in over 200 different languages. The ICC will also gather other information like your home address, date of birth, and full or partial social security number. The usual stuff. That helps streamline any care you might need. You'll also talk about the incident. What hurts, how it happened, where it happened, when you reported it to the supervisor, immediately is always a good answer, and who else was around. Speaking to an ICC is important. The information gathered at this stage is used to file the first report of injury, which is required by the state in reporting a workers' compensation claim. We get all that information quickly and transfer you immediately to a registered nurse. So what's it like talking to the nurse? The nurse will quickly validate the information you just gave to make sure you're you and not someone else. Then you'll answer some questions about your injury. From there, the nurse will either recommend self-care like ice or aspirin, or suggest you get treatment at an appropriate medical provider. The nurse will send all necessary reports to your employer and, if a referral is made, to the medical provider. This will make the process that much easier and quicker for you. You might think you can skip all this and just go to the emergency room. Not so. Most injuries are not emergencies and require only self-care. If you do need medical treatment, a pre-verified provider like an urgent care or occupational medical facility often are better than an emergency room. You heard the word pre-verified. That means we've made sure that any medical provider we send you to is open, is located where they say they are, and able to treat your kind of injury. Now you might be thinking, well, usually I just shake off an injury or take care of it myself. Maybe I don't need to call company nurse at all. Not true. Nurses are experts in delivering triage care and first aid. You may very well need that. Why risk it? If the nurse recommends self-care, you'll get an incident ID number. That way, should you need to call back, we can pull up your information and help you quicker. Sometimes our nurses will give you self-care instructions to do while you wait to see your medical provider. You really want to follow the nurse's instructions. They're in your best interest. Regardless of whether the nurse recommends self-care or a visit to a medical provider, the nurse will always record the details and file an injury report. That protects your rights under workers' compensation law in your state and encourages your employer to put procedures in place that will help prevent future injuries. That's another reason it's so important to call company nurse first and follow the nurse's instructions. Even in emergency situations, once your injury is stabilized, call company nurse so we can document what happened. And if you're unable to call, please, for your own safety, have your supervisor call. A few more important points worth mentioning. Nurses cannot authorize time off. Only the medical provider you see can do that when warranted. And this is a triage service for on-the-job injuries. Nurses cannot give you general medical advice. nurses cannot give diagnosis and can't refer you to a specialist. But what our nurses do all day long is care for injuries as soon as they happen. If you've already been treated by your own physician, you still should report the injury through company nurse. That ensures your employer is aware of all injuries and incidents. But remember, you should call company nurse first. You may be wondering if you'll have to complete other work-related paperwork for your employer. This depends on your employer. Make sure your supervisor knows about the incident and then follow your employer's procedures. Finally, once we take care of your injury, there's no need to report back to company nurse. That's really it. So remember, accidents happen, call company nurse first. And if our nurses recommend treatment, take it because it's in your best interest. If your injury is such that you can't call company nurse, have your supervisor call. If your supervisor isn't around, have someone nearby call. It's important and it protects you. The fact is, your employer cares about you and your safety. Company nurse would not be an employment benefit at your company if they didn't. So use this important service. It's here for you.